Hello, my name is Joseph Rivera, and today we're going to be doing x-ray projections of the knee, as well as the intercondylar fossa and a patella projection. Hello.
Hi.
Hello, my name is Joseph Rivera, and today we're going to be performing some x-rays on your knee. Can I have you confirm your first and last name for me?
Sylvia Brown.
Sylvia Brown, and can I see your wristband here?
Yeah.
Sylvia Brown, and your date of birth?
12984.
Alrighty, Sylvia, and what brings you in today?
I hurt my knee doing yoga.
Hurt your knee doing yoga, and it's your right knee, correct?
Yeah, my right knee.
Right knee, and how long ago did this happen?
Last Monday.
Last Monday.
Last week.
And is there any certain area where your knee may hurt more?
It's pretty much just below right here.
Just below. Alrighty. And before we start, is there any chance of pregnancy?
No.
Alright, Sylvia, I'm gonna have you come right up here.
Okay.
Alrighty, I'm gonna grab Sylvia a shield to protect her, put that over her lap. And since she is a smaller patient, I am going to be angling the tube 3 to 5 degrees caudad, and the CR is going to enter about a ½ inch below the apex of her patella. I'm gonna position her here, got my tube all set up. And line up your bucky, make sure it's lined up. And it is her right knee, so we're going to mark it with our right marker. Come in a little bit on her knee. Alrighty, Sylvia. And I'm just gonna have you hold still, and I'm gonna go take the x-ray. And a ballpark technique for an AP knee projection is about 70 at 10. Alright, Miss Sylvia, hold still, x-ray. Perfect. Alrighty, done with our AP. Now we are going to do an AP oblique followed by a lateral projection. I'm going to keep my tube angle of 3 to 5 degrees caudad, and my CR is still going to enter a ½ inch below the apex of her patella. This time though, we are going to rotate her knee about 45 degrees internally and make sure our bucky is all lined up once again, and we are using a grid for all of these knee projections. Make sure our distance is okay. 40 inches is going to be our measurements for all of these knee projections, and my technique is going to stay at 70 at 10 once again. Alrighty, Sylvia. Right knee once again, and we are going to be taking the x-ray. Just hold still for me. X-ray. Perfect. Thank you, Sylvia. And we're going to move on to our lateral projection. With our lateral projection, we are going to be rolling our patient onto the affected side, so it's going to be her right side. So if I can just have you roll over to your right side, Sylvia, put your left leg over and keep your right leg back. Perfect. We're going to shield, and we're going to bend her knee about 20 to 30 degrees. This time we're going to angle our tube 3 to 5 degrees cephalic to open up the knee joint, and our CR is going to enter about an inch below the epicondyle of the knee. We're going to keep our same technique of 70 at 10. Line her up. Our right marker, and we are using a grid once again. Line up our bucky. Perfect. Alrighty, Sylvia. Hold still, and I'm going to be taking the x-ray. X-ray. Thank you, Sylvia. On that one, we did keep our distance of 40 inches. We are done with our AP, oblique, and lateral knee projections, and we are going to be moving on to our intercondylar fossa projections. Alrighty, Sylvia, we just got done with all your knee x-rays. We're going to be doing a intercondylar fossa projection on your left knee now. It's going to be a PA axial, aka the Holmblad method. I'm going to have you come up on the table here on all fours if you can. Thank you. I'm going to shield her again. So good. Our CR is going to enter on the lower long axis of her leg, entering the backside. We're going to be at 40 inches once again. And you're going to center your IR to the middle of the knee. So yeah. We're going to form a 70-degree angle with the back of the leg. And we're going to column it in 70 degrees. Perfect. And we are using an 8x10 gridded cassette, and our technique is going to be 70 at 10. Alright, so yeah. If I can just have you hold still, and this is her left leg. Marker on the lateral side. X-ray. Perfect, Sylvia. And our CR is going to enter perpendicular. No angulation on this one. Here, thank you. And I will go around this cassette.
Thank you.
You're welcome. Alrighty, Sylvia, we got one more projection to do. That's going to be our tangential patella projection, aka set of gas method, sunrise method. Alright, so I'm going to have you come up here on the table facing the tube. Perfect. I'm going to put a shield over you, right over your lap. You can. I'm going to bend your knee up, form me an angle, and I'm going to have you hold the IR here. We're going to want 40 inches once again, and we're going to use a technique of about 60 at 3. Perfect. All right, Sylvia, we're going to match our angle of the tube to her knee. Down. Higher a little bit. Perfect. And we're going to enter between the femur and the tibia, right in between that joint space. Perfect. Right there. Hold that for me, Sylvia. Yeah. Matching, and we're going to mark it with our right marker. It's your right knee. Ready. Good. 40 inches, and I'm just going to have you hold still. We're shooting on an 8x10 non-grid. All right, Sylvia, hold still. X-ray. Perfect. And I think that we're all done for today, Sylvia. Thank you very much.
Thank you.
Thank you. In our first projection of the AP knee, the patient is supine with the femoral epicondyles parallel to the IR. The CR will enter at a point 1/2 inch inferior to the patellar apex. The CR angle depends on the thickness of the pelvis of the patient. If the pelvis is less than 19 centimeters, you are going to want to angle the tube 3 to 5 degrees caudad. If the pelvis is 19 to 24 centimeters, a 0-degree angle should be put on your tube. If the pelvis is greater than 24 centimeters, 3 to 5 degrees cephalic is necessary. You are going to want equal parts of the femur and the tibia and fibula in your image. Joint space should be shown with the intercondylar eminence present. Our second projection was the AP oblique knee with medial rotation. The knee is going to be medially rotated 45 degrees, and the CR will enter in 1/2 inch inferior to the patellar apex. The patella will be seen on the medial side of the knee, and an open joint space of the tibiofibular joint articulation site will be present. The knee will once again be centered to the IR with equal parts of the femur and tibia and fibula shown. On my lateral projection of the knee, you are going to want a medial lateral projection. The patient will lie on their affected side with the knee flexed 20 to 30 degrees. The central ray will be directed 1 inch distal to the medial epicondyles at an angle of 5 to 7 degrees cephalic. This angle will open up the joint space shown here. This is due to the medial condyle being slightly inferior to the lateral condyle. For trauma situations and patients that are unable to be moved, a cross-table lateral is preferred to show fluid levels in the fat pads around the knee. In our fourth projection, we projected the intercondylar fossa at a PA axial projection, aka Holmblad method. In this projection, our patient was kneeling on the table with their knee flexed 70 degrees. The femoral and tibial condyles were parallel to the IR. The central ray was perpendicular to the lower leg and enters midpoint onto the IR. Numerous PA anatomical landmarks are going to be present, with this being shot from the posterior side of the patient. Your lateral femoral condyles, your intercondylar fossa, which we are looking at, and your medial femoral condyles, as long as others will be shown. Our last projection was of the patella. This was done in a tangential projection Setagast method, aka sunrise method. The patella is shown in profile and shown with an open femoral patellar articulation. The medial femoral condyle is shown and the lateral femoral condyle is also shown. The patient is supine with the knee flexed, holding the IR behind the knee. The angle of the tube is dependent on the degree of flexion of the patient's knee.